Hello. Good evening.
Good evening, sir.
Good evening, Prof.
Good evening, Prof.
Good evening, Prof.
Good evening,
Yeah, good
evening,
evening.
Prof.
Thank-
Good evening, Prof.
Yes, thank you. Okay, so we are going to continue today's lecture. Yesterday we started by asking and answering the question on why we study history, and we gave different reasons. One of the most important one is if you know history, if you know the past, you'll be able to understand the present, and you can actually predict the future. We also talked about so that good deeds are remembered. We also talk about learning lessons. Even if our intentions are for the common goods, they may be misconstrued. And then we also talked about history that promotes team spirit, because yes, especially if we know how the various health professionals came into being. Then we talked about diseases, the first sign of infection, which we said is mitochondria. We also talked about one of the earliest evidence of disease, which we found in the statuette of the Venus of Willendorf. We also talked about the fact that endemic diseases, which are diseases that are found commonly present in the community and kill at a rate that members of the community are used to, are usually treated by the individuals themselves, starting with folk medicine, which are medicines that are known to everybody. And if symptom persists, they will consult medical practitioners. If it is in the traditional society, they consult the traditional medicine practitioners. And we said that scientific analysis of the remedies of these traditional medicine practitioners have shown that they contain little or no active ingredients, yet they are effective. And the reason for their effectiveness has been linked to placebo effect, which is the effect an individual gets, not because of the drug, or because of the belief in the efficacy of the drug. Okay, and we talked about the various methods or various ways these traditional medicine practitioners, the various ways they use to convince the patient of the effectiveness of the drug. We talked about incantations. We talked about going into trance, and so forth and so on. And we say that this placebo effect is also used by other faith healers, especially those in the main religion of Christianity and Muslims. And that's why they will always insist that the patient should have faith. They should believe and have faith. Okay? And then we talked about the various traditional medicine practitioners, the witch doctor, the herbalist, the diviner, The specialized practitioners. We also talked about them and their relevance in the present society. And then we also talked about the chief priests, who are the traditional public health practitioners, because they are interested in taking care of the community as a whole and not just the individual patients. For the individual patients, when they treat them, their objective is to keep them, hide them, isolate them, isolate them so that they will not become a threat to other members of the community. Okay, so, and we also talked about preventive measures. Preventive measures are appropriate to the cause of the disease. So if it is supernatural, you have to deal with the spirits. And to deal with the spirits, you can appease them, you can obey your parents, keep the custom and traditions, and then yes, keep the custom and traditions. For the natural causes, you avoid the natural hazards. For example, not walking under the sun, not exposing yourself to cold, and then although this one is not scientifically correct, women in messes being said to be spiritually unclean and therefore isolated in their homes. Okay, so that is what that is a summary of what we did yesterday. So today we'll be discussing disease prevention. Oh, seems did we discuss this yesterday? Okay, no, we didn't. Okay, so we're talking about disease prevention and control in biblical times.
No, sir.
We are going. Okay, so okay, I was okay. So we are going to start with this thing. So we are going to even those of us that are Christians, we may not realize that when it comes to diseases and the treatment of diseases, the Old Testament is different from the New Testament. We may not realize that, but that is what we are going to teach in this particular lecture. In the Old Testament, the people of Israel, unlike their neighbors, believe in a single all-powerful God, who is the source of health and disease. So in the Old Testament, the Israelites believe in one single all-powerful God, who is the source of health and disease, which means that God gives health as a blessing. God blesses our good deeds with health and punishes our bad deeds with disease. Okay, so in other words, so this belief in a single all-powerful God that dispenses health and disease at his discretion ensure that the people of Israel, the Old Testament Israel, ensure that they rely entirely on God for the cure of their diseases. They rely entirely on God, discouraging them from trying other medical procedures which are usually linked to the worship of foreign gods and goddesses. Okay, so the people of Israel, the Israelites, were encouraged to, when they are sick, to consult the priests, who will now seek the face of God and then prescribe the treatment. Okay, that was the prescribed health-seeking behavior. But one of the kings, King Asa, did the opposite. Instead of consulting the priests of God, he consulted the physicians and died. King Asa consulted physicians and died. I must say that when we talk about the Bible, or some translations of the Bible mention that he consulted the physicians. Please, the physicians he consulted are not like the present day physicians. The present day physicians are secular. They don't believe technical, by definition, they don't believe in any God. They don't factor in the supernatural in their treatment of diseases. Whereas in the years past, the doctors are usually priests of a certain God. In fact, that is one of the reasons why the Israelites were told to seek. That was one of the reasons why every disease or every health were placed under the discretion of God, because he discouraged people from seeking treatment elsewhere. Okay, we also know that the Bible also gave the example of King Hezekiah, who did the right thing by consulting the priests, and he was even rewarded. He was not only healed, but rewarded with, but his life was extended by 15 years. Okay, his life was extended by 15 years. Okay, so if we move to the New Testament, we'll recognize that in the Old Testament, in the New Testament, demon became a major cause of disease. Demons became a major cause of disease. In fact, the Lord Jesus Christ healed a lot of persons, casted out demons from people. Okay? But before you cast out demons, you must have a power that is higher. Before you are able to cast out demons, you must have a power that is higher than that of the demon. It must have a power that is higher than the demon. And that is where the people with the healing anointing came into play in the New Testament. People with healing anointing, they came into play in the New Testament. So the problem now is, how do you acquire that healing anointing? How do you acquire that power that is strong enough to cast out demons? There are no obvious ways. The ways of acquiring those powers were not mentioned in the Bible. At least I'm not aware of any. I know that growing up, people talk about secret books. People talk about secret. I grew up in the village, sir. So people talk about secret books. Some people say 7 books of Moses, or all those secret books. But there are no ways. But what we know in the contemporary, amongst those that are contemporary faith healers, is that they are increasingly seeking these powers in pagan sources. They are increasingly seeking these powers in pagan sources. So if you look at this, you can see corpses. And this was the foundation of a cathedral being built in Enugu. So people were even up to people are even carrying out human sacrifice to acquire these powers. And those that couldn't do that, some of them are actually also trying to fake the miracles. Trying to fake the miracles. So that is almost like a summary of the disease and healing practices in the Bible. The first one, the Old Testament, where people believed, where it was stated that the disease and health are given at the discretion of God, and anybody that got sick will have to consult the priest of God, who will now consult God for and prescribe treatment. Okay, and people that did otherwise were punished. People that did the right thing were rewarded. And then Okay, so we fast forward to the Old New Testament, where demons were recognized as a significant cause of disease, and of course, demons are extraneous. They are extraneous. They are evil. So the healing involved, their healing, the healing of those of an individual that is possessed by demons will be to cast out those demons, and casting out those demons require powers. And unfortunately, people are going into pagan sources to get those powers. People are getting into pagan sources to get those powers. So the next thing, we'll go to the Christian hospitals. We'll have a look at Christian hospitals. When the Lord Jesus Christ went back to heaven, he commanded his disciples to take care of the poor, the sick, the stranger, the poor, the sick, and the stranger. And they try to do that. They try to do that by building a hospital, by building hospitals. So these early Christian hospitals were were places for the caring of the sick, not only for the sick, but also for the poor and the stranger and the migrants. So they were dealing with all sorts of persons. For the sick, the sick were only provided mostly with nursing services with very little curative medical practice going on. And because of that, a lot of them died. They died so much that these hospitals were called the stairway to heaven, because people literally went there to die and preferred and actually preferred to die there, because they believed that if they died in those hospitals, they would just move straight to heaven. They would just move straight to heaven. Okay, so that is that. Then these hospitals were funded by the charitable giving of the aristocrats and the lords and the kings. And those people they were committing a lot of atrocities. But they believe that if the more charity they give, the less time they spend in purgatory. So they paid in a lot of money that was used in taking care of the sick and every other person that they cared for in these hospitals in quotes. Okay, so but the running of the hospitals became disrupted by two events in Europe. The first was the rise of Protestantism, Protestants, led by Martin Luther, and of course the quarrel between King Henry VIII, King of England, and the Roman Catholic Church. Okay, so for the rise of these Protestant preachers, they preached against the purgatory, and that discouraged the donors from bringing their money to run these hospitals. So the hospitals became underfunded, and that affected their operation. Okay, and then the other one, of course, the quarrel between King Henry VIII and the Roman Catholic Church led to the taking over of the hospitals operated by the church by the government. Okay, so this is the first time government this is the first takeover of hospital by government. Okay, or this is the first time government was providing hospital services. Okay, and especially the three hospitals taken over by King Henry, they went on to play prominent role in the history of healthcare, and they include St. Bartholomew's Hospital, St. Thomas's Hospital, and St. Mary of Bethlehem Hospital. They played very active role in healthcare. For example, it was at St. Bartholomew's Hospital that William Harvey conducted his research, proving that blood actually flows from the heart to the arteries, down then to the capillaries, to the vein, and back to the heart. Previously, they thought other things. Previously, they thought other things. And it was at St. Thomas's Hospital that Florence Nightingale pioneered the professional training of nurses. So, and then this Bala, St. Mary of Bethlehem Hospital, they pioneered the treatment, the proper treatment of the mentally ill. They pioneered the proper treatment of the mentally ill. So these hospitals that we are taken over by the church, that were taken over by the church, played a very prominent role in the development of healthcare. Then the other one, yes, or the secularization, the taking over of these hospitals by government made them secular. So made them secular. Previously, when patients were admitted in the hospitals, they took part in all the religious activities. But with the taking over of the hospital by government, hospital chaplains were appointed. And these hospital chaplains only preached to patients that gave their consent. These hospital chaplains only preached to patients that gave their consent. Okay, so that is and that is still in force. That is still in practice even today. So when the religious people go to hospitals, they are expected to pray, or to minister to only those that gave their consent, and not to do a capture audience thing, like has been observed. For example, instead of giving health talk, people are actually preaching to those that, not only to those that who want to listen, but also those that do not want to listen, or those that are not even of the same religion. That is unacceptable. Okay, the other thing we have to also talk about is, of course, the funding of the philanthropy. So when people were not given to benefit from purgatory, there arose philanthropists, those that have money or had money, and they use the money to build hospitals. Philanthropists, and one of the most prominent was Thomas Guy. He was a healthy merchant, and he built the Guy's Hospital, London, in 1724 for the treatment of the incurables discharged from the St. Thomas's Hospital. Okay, and other hospitals were built all over the world, and some of them, like the Massachusetts General Hospital, are now some of them are currently offering one of the best services. For example, when the list of the best hospitals are compiled, this Massachusetts General Hospital usually ranks amongst in the top 10. Okay, so the other thing to talk about Christian hospital is the faith healing hospitals. So when you watch the faith healing of tele-evangelists, you will probably think that it will be proper, or it will be right for them to build a big hospital so that people can go there and get healed. Okay, and get healed. And this guy tried it, Ora Roberts. He tried it when he established the City of Faith Medical and Research Center. When he established the City of Faith Medical and Research Center in 1981. Unfortunately, this center didn't last long. Didn't last long because of low cure rate. Low cure rate. The hospital didn't cure patients more than the other hospitals. They didn't cure patients more than the other hospitals. They didn't cure patients more than the other hospitals, and that was the reason why they were stopped. Okay, so I've quickly gone through diseases and healing in the Christian in Christianity. I don't know if there are questions or comments that we can take before we go on.
Good evening.
Yes, Mesoma. Hello. Hello. I thought, okay, she answered. I don't know if she's there too. So if you have any question or comments, you can raise your hand so that we can have it before we move forward.
It was very clear, Prof. No question.
Okay, no question with you. Okay, it's all right. I will move forward if there is none. Okay, the other one, we have to go to the Muslims, the Muslim diseases. Yes, I don't know. I think the most important, anyway, what we are going to discuss, what we call Arabic medicine or Islamic medicine. And this Islamic medicine, we're talking about the medicine that was practiced in what they call the golden era or the golden age of the Islamic civilization, and it will include all the practitioners that wrote in Arabic. So there are people of different religion, different religion, but they wrote in Arabic and lived under the Muslim, and were under Muslim rule. So yes, they were under Muslim rule. Okay, the Muslims, of course, Muslims consider Prophet Muhammad, peace and blessing be upon him, as an exemplar. So they try to emulate his deeds in their life by following his traditions and the Quranic instructions. Okay, so for the Muslims, their belief about health and disease is similar to that of the Old Testament. Everything, all power, God is all powerful. He gives health and disease at his own discretion. And if one is touched, if one is sick, the best way of recovery is to seek, is if God grants him that recovery. If God grants him that recovery. But also the good thing is that the Muslims, they also believe that God did not create any disease without creating a medicine. So the Muslims believe that God did not create any disease without creating a cure. So based on that, what was led for the Muslims, especially in their golden era, was to look for the cure. Was to look for the cure. And they looked for the cure everywhere they went. Everywhere they went, they were looking for the cure. Everywhere they went, they were looking for the cure, and including amongst those that they conquered. And one of those that they learned a lot from were the Nestorians. The Nestorians were a Christian sect that were banished for being heretics. They are banished for being heretics because they were said to have beliefs that are contrary to the teaching of the Bible. But these Nestorians were known for their medical practice, especially the way they organize their healthcare. The way they organize their healthcare. And one of those things that the Muslims learned from the Nestorians were how to organize the mosque. So the mosque was built as a worship center, but with attachments like a school and even a hospital. a school, and even a hospital. So if you see a typical mosque in anywhere, you will notice that there is a worship center, a mosque, there is a school, the makranta, I think that's what they call anyway, especially in the north. And then they also had hospitals or places where they treat the sick. Okay, this was copied from the Nestorians. Okay, the other thing the Muslims did was they looked for treatments, cures in Greek medical textbooks. They looked for cures in Greek medical textbooks. And what they did, they read, they understood, they added their experiences, and then wrote their own book. They learned from the Greek text.
I paid school fees.
Yes, they learned from the. Okay, the guy is complaining. I hope he wasn't complaining to his wife. I paid school fees. Okay, so the Muslims, they read the Greek texts, translated into Arabic, learned, understood the Greek medical textbooks, and then added their experiences, and then wrote their books, wrote wonderful books. So we are going to look at the prominent authors, people that wrote, those illustrious authors of Islamic medical books. And they include Abu Bakr Muhammad ibn Zakaria, known to the West as Rhazes, and then Abu Ali al-Hussein ibn Abdullah ibn Sena, known to the West as Avicenna, and then the Abu Qasim, known to the West as Abu Qasis, and then my own personal favorite, Abu Umran Musa ibn Mamun, known to the West as Maimonides, Moses Maimonides. Okay, so these are four very prominent writers, authors of Islamic medical textbooks. And we are going to look at them one after the other, starting with Rhazes. Rhazes was born in Iran, which means he was a patient, but he was trained. He had a medical education in Baghdad, which is an Arabian city, but he trained under a Jewish physician who taught him Greek, Persian, and Hindu medicine, which means so he was cosmopolitan. I must say that what made this era in the Muslim world golden was that they let people practice irrespective of their religion. So societies develop when people are allowed to thrive irrespective of their religion. Okay, so imagine this guy, one of the greatest, one of the most illustrious Islamic medical authors, Rhazes, was a Persian, as Iranian, but he had his education in Baghdad, and he was trained. He trained under a Jewish physician who taught him Greek medicine, Persian medicine, and Hindu medicine. Okay, and so he started his practice, and before going to Baghdad, when he became very prominent, very, very prominent. He was said to be the chief of the practical physicians, which is very, very instructive, because doctors of that time, especially in Europe, they just go there and move stuff, what we call move stuff. They just go and speak big English, and do nothing to the patient. Probably they just, I think one of them, they just go there and move stuff. So, but these Rhazes actually treated the patients. Okay, he treated the patients, but most especially his significant contribution was that he wrote over 200 books. Which which influenced medical practice in that era. Then this guy, Avicenna, another patient, that's another Iranian. Yes, this one was self-taught. Was said to have very brilliant guy, because he was said to have memorized the Quran by the age of 10. I know that our Muslim colleagues will know how difficult to memorize the whole, to recite, being able to recite the Quran from the beginning to the end. And he did that at the age 10. He started medical education at 16. And medical education then consists mostly of reading the textbooks. And this guy, the guy with a very powerful memory, he was able to complete the education by 18. By 18, he has read all the books, he went and passed the exam, and he became a doctor. He didn't train under anybody, nobody. He didn't have any teacher. So to gain experience, he was providing free medical services in, we talked about the mosque having a hospital attached. So he went there, he provided medical services free of charge, and that was how he gained experience. His reputation grew, and he was made a court physician. That is for you to be made a court physician to treat the sultan or the caliph or the emir was one of the highest positions one can have. So this guy had it. But we are discussing him because of his book, the book he wrote, which he called the Canon of Medicine. Canon of Medicine was supposed to be the end of discussion. He wrote this book, added everything he believed one should know about medicine. And he believed that he has covered all. And that was the reason why he called it Canon of Medicine. Canon of Medicine, because he thought that he wrote a book that he said would be almost like the Bible or the Quran, that cannot be changed because they cover everything. They cover everything. And to tell you the truth, it was used for centuries. Not only in the Islamic world, but even in Europe. But we now know it's no longer being used because medicine has since moved on. Then I talk about this guy as my favorite, Moses Maimonides. A Jew. He was a Jew, but he was trained by a Muslim doctor, Abu Wahid. So a Jew that was trained under a Muslim doctor. Okay, and then so he was a rabbi, a pastor. Anyway, we can call him a pastor of the Jews. But he was also practicing medicine. And I like him because he wasn't a two-face. He wasn't a two-face like most of us, because most of us, we are two faces. When we are in the hospital, we are scientific. When we are in the church or mosque, we are devout. So when they give some of those testimonies that they give, they say, I have appendix, and they are pointing to the left. You know that the appendix is not at the left side of the abdomen. But we agree. And women will say, oh, they were pregnant. They were even seeing their menses. The pregnancy was at the back. And before you know it, they started having abdominal pain, and then went and delivered the baby. Praise the Lord. And we accept it. We accept it because we are two-faced. But this guy, he wasn't. In fact, as a rabbi, he was considered one of the greatest rabbi in the Jewish world. So much that they were saying that from Moses to Moses, there was nobody like Moses, which means that they said from Moses of the Bible to Moses Maimonides, there was nobody nobody like Moses Maimonides, which means that to the Jews, he was even higher than some of those lesser prophets in the Bible. So he was a great man of God. He was a great man of God, but he didn't claim to be inspired by God. He didn't claim to be inspired by God. So he humbled himself and learned under not even a Jewish physician, but a Muslim physician. He learned under him, under Abdul Wahid, and then he was taught the Torah by his father, and he became a rabbi. And he used the knowledge of one to improve the practice of other. So he used, and he became known, reputed for his treatment of psychosomatic illnesses. That is illnesses with a mental health components. And he used his knowledge of the Torah in practice. So he was able to develop powerful, very good treatment protocol for psychosomatic problems. He was so good that even as a Jew, he was made the court physician of Salahuddin. Those that are conversant with Islamic history of the Islamic religion would have heard of Salahuddin, Caliph Salahuddin, one of the greatest caliphs in the Muslim world. And he had Moses Maimonides because of his proficiency, in spite of the fact that he wasn't even an ordinary Jew. He was a rabbi. And he became so good because he was able to combine the two, the teaching of the Torah and the medical knowledge he acquired from reading medical textbooks and from his training. Okay, so if we are able to combine the two, if you combine religion with even modern medical practice, it's almost like you will become a miracle worker, because you will be able to treat patients. You'll be able to tease out that placebo effect from patients. Okay, so this Moses Maimonides, yeah. Okay, so the other one, so we can continue. So the other thing is the next one is to talk about the contributions of Islamic medicine to modern healthcare. And usually we point out four contributions. The drugs, the contribution to ophthalmology, that is eye care, modern health systems, and then modern health system, and medical, the fact that they help to preserve the ancient Greek medical text. The fact that the contributions of Islamic medicine, there are four main contributions: the drugs, the eye care, that's ophthalmology, modern health system, and of course the fact that they helped in preserving the ancient Greek medical textbook. Without the Muslims taking hold of this ancient Greek medical textbook, we probably would have lost Hippocrates and Aristotle and Galen, because at that time in medieval Europe, they were burning them up. They were organizing bonfire with the works of Hippocrates, because they were thought to be from pagan sources. Okay, but the Muslims, they helped us. They helped us in preserving these Greek medical texts. So one of their contributions. But the other one is the drugs. They introduced more than 1,000 drugs. More than 1,000 drugs, because they had that skill of alchemy, especially the patients. They have the skill of alchemy, so they were able to develop drugs. Remember, Remember that believe that God did not create any disease without creating a cure. So they were actively looking for cure. They were actively looking for cure. As you may have realized in those Arabian Nights, they were all the people. They were all busy looking for the elixir of life, a drug that can make one, live forever, literally. Literally, so they were looking for. But unfortunately, most of their drugs are no longer in use because most of them contain heavy metals, and heavy metals are poisons. Heavy metals are poisons. So yes, heavy metals are poisons. So some of these, the so-called drugs were actually too toxic to be used. Okay, but another thing too, they were the people that introduced the use of syrups. They were the people that introduced the use of syrups. But unfortunately, syrups don't keep too well. Syrups don't keep too well, especially in hot environments, such as the Middle East. They don't keep too well. So to solve that problem, they developed special storage containers for this syrup called Abarele. And so Abarele was able to preserve the effectiveness of the syrup that they developed. Okay. And another thing about drugs is that remember, we talked about the secret remedies of traditional medicine practitioners. In the Islamic world, when they discover any drug, they let it known to everybody. They teach it to everybody. Or they teach it to people that care to know. Remember, we talked about Makranta. That's Islamic school. The Islamic school that is attached to the mosque was a place where these things were taught. So they weren't taught how to recite the Quran. They were taught other things. They were taught science. They were taught astrology, and they were taught medicine. And so these medical practitioners, those that developed, those that read the Greek textbook, they translated them and made them available in those schools, Islamic Quranic schools, and those that made discoveries, they also made them available in those schools. Okay, so we have to commend them, especially in their development of those drugs. They not only do drugs, the fact that they develop syrups, and they not only develop syrups, a special storage container for the syrup, and then the fact that they made their discoveries known to everybody. Okay, the other one is eye care. Eye care. They were specialists in the treatment of eye diseases. And yes, treatment of eye diseases. Because in the Western Europe, it was considered very dangerous to treat eye diseases because of the risk of side effects. The risk of side effects, you can go to treat and it gets worse and the person gets blinded. And in an era where they have an eye for an eye. So if you imagine, if you treat a patient and the patient loses his eyes, then you'll be in trouble. You'll be in trouble. You either lose your eye or you pay not to lose your eye, not to have your eye plugged off. So because of that, they were very, very in Western Europe. They didn't a lot of times they didn't they didn't attempt to treat any eye problems. But there are eye problems were very, very common in those societies in the Middle East because of they live in a dusty environment. The sun is bright. Causing reflections that probably cause cataracts, and that also led to the discovery of this guy, Aman ibn Ali of Mosul. who was able to develop a special syringe that he used for the extraction of soft cataract, which means that this guy was literally or was able to make the blind see. He was able to make the blind see. If it were to be traditional medicine practitioner, he would have been doing it in secret. He wouldn't have told people. He wouldn't have told people about his infection, his injection syringe. He wouldn't have. He could have done it. He could have done it in secret. He could have done it in secret, just to present, just to yes, could have done it in secret, and he would just say that he performed a miracle, and know which miracle would have been higher, or better than making the blind see. Okay. The other one is the contribution to medical practice. So the Muslims, they had what can we call them, clinics or hospitals attached to the mosque. So people went there to practice. Avicenna went there to gain experience. But I guess that there are others, or the emirs and the lesser functionaries would have recruited people to teach and to provide care in those hospitals. And there would have been some there would have been itinerary Islamic scholars with the healing, with training in medical care. They would have provided services in those hospitals that were attached to those clinics. Okay, so we have gone through the history of Islamic medicine. I don't know if there are questions or contributions. So we have Amarachi. Hello, Amarachi. Hello, Amarachi.
Yeah, good evening, sir.
Yeah, good day, man.
Yes, thank you for this interesting session. And it's so great to see all the contribution that was made by Islamic medicine to the public health. So I don't really know if I missed out on the contribution made by the Christianity medicine to public health. I would really appreciate if you can highlight that.
Okay, anyway, because what we have, we call it Western medicine. And Western medicine was from Christianity. Yes, so it's a given. So the other thing is just that we wanted to highlight the other parts. So everything we have in present day medicine actually came from Christian Europe. But the other thing we have to say is that mentality. You have the development of medicine in Western Europe actually changed when they began to think outside the prescriptions of the church. And of course, it's also affecting us. It's also affecting us because we are almost like medieval Christians. Medieval Christians, we are almost like Christians at the same level of Christianity, or the same brand of Christianity that were practiced by the Europeans in the Middle Ages. Because when you I don't know if you have heard of this statement that God said it, I believe it, that settles it. If you have that mentality, it means that you cannot go and look for any other cure. Yes. So if you believe that, a disease came and you accept it, you are not likely to have look for treatment. So that is if you practice the kind of Christianity that we practiced now, it slows our development. So in the Europeans, those Western Europe, they believed just as we do now, until the Reformation age, where they began to question a lot of things. And when they question a lot of things, the development flowed in. Okay, it's all right. Hello, Kenneth Onyema.
Prof, good evening.
Good evening.
Thanks for this wonderful teaching. Please, Prof, I want to make a case, because
Yes.
from this wonderful teaching this evening, I realized that, Christian medicine practice is all about placebo, but Muslim is beyond placebo, because it is the real context of medicine practice. That is the real practice of medicine, because the last person you spoke about that developed syringe and needle to take care of eye problem. So my question is, are those things no longer in existence in Nigeria medical practice?
Yeah,
that's my question.
I think yes, I think they have. They when the Muslims started, they were very tolerant.
Okay.
They accept. They conquered a lot of areas.
Okay.
But they allowed the conquered to practice. So the Jews were practicing, like example that Moses Maimonides, who wasn't just a Jew, he was a rabbi, and he was good enough to be the personal physician of the caliph. Personal physician of the ruler of the Muslim world. Not just a Jew. So they were that tolerant. But it changed. It changed when they became intolerant. When they became intolerant, such that they have stopped their development. The Islamic medicine stopped developing probably around the 16th century. So for example, there is no germ theory there. And a lot of these our drugs are not there. So what they are practicing is what they discovered around that 16th century. So that is the thing. That is the problem of intolerance. Intolerance. And okay.
But Prof, I still want to, I don't know, as a public health practitioner, so how to bring back that form of practice into existence now, because it's going to go a long way, like eye for eye. As a medical doctor, the moment you caused a harm or a casualty to your patient, then pay for it. What do you think?
Anyway, the eye for an eye, that time, anyway, they were also very cautious. But that is also what is happening in, say, the US, where the medical malpractices suit is so much. Okay. So there is no doctor in the US that can practice without a medical insurance because they can't pay. And they're also very cautious. They over-investigate the patient. They over-investigate the patient so that they cannot be found wanting. And that adds to the medical cost. And at times too, when patients say, I beg, and because the patient doesn't have money, and you try to cut corners. And if anything happens, you'll be surprised that the patient that said, I beg, that you try to help will now say you didn't give the right treatment. And that's why he got worse, or that's why he died, or that's why he developed a complication. So it has also affected medical practice. So such that in the US, they spend one of the highest in medical care, but they don't have the best health. They don't have the best outcomes. So I don't know. I think if so, that is a problem. That is a problem.
Okay,
okay. Hello.
Lastly, how do we correct the wrong? Lastly, as a public health practitioner, how do we correct how do we right the wrong? How do we bring back? That is my own now. So all these are studied now. How do we put it in practice by correcting the right? Because the health of the masses is most utmost. So how do we just come in now to make sure we do the right thing?
Yeah, okay. I don't know. I think it's the will.
As we are studying now, how do we practice it? How do we just let public know that?
Yeah, Kenneth. Unfortunately, your network is becoming problematic. But the thing is that you are saying, how do we practice it? It can
come in here now as a public health.
It's all right. It's all right.
Or practitioners.
The thing there is that there are ways of doing that. Like primary healthcare, where primary care has been defined as culturally accepted, and culturally accepted and scientifically sound technology and methods. That is primary healthcare. So all these things, but I don't know. I think we are confused as per what to do. Primary healthcare is community based. It's a bottom up, not top down. And we are not getting it right, because the methods will have to be culturally based, culturally accepted, but scientifically sound. So the culture, what is culturally accepted in the north may not be culturally accepted in the south. So there is no one. It has to be developed by the community. Okay, we can move forward. Hello, Talks. Hello, Talks.
Yeah, good evening, sir.
Good evening.
Yeah, Prof, it's an interesting lecture. I'm really excited with this lecture. I must say the truth. But I have a few questions concerning the Christian medicine, and why is it that we have celebrated Muslim authors and we don't have celebrated Christian religious medical authors?
Okay.
Anyway. Or is it that, like you said, they gather, they preserve. Muslim preserve the records that were made by the Christian or modern medicine. So no specific author to be mentioned.
Okay, like in Christianity.
Yes.
No. Yes, I think it has to do with that disposition. In Christianity, the emphasis became that of healing. That of healing. And healing is supernatural, especially as the Lord Jesus Christ did a lot of healing by casting out of demons. We're talking, so it's not, those things are not within the realm of modern practice. And we are talking about things that are things we know. And we mentioned those with healing anointing. And those with healing anointing, we are supposed to be people able to handle more difficult illnesses. And we have identified that for you to do that, you should have the ability, you should have a power that can dislodge the demon. And we are still, personally, I'm not aware of how that can be done. I know that growing up, I hear a lot of stories. I hear seven books of Moses and some of those things. That is where people go. But with with what happens in the things that happen in the contemporary society, you will know that people are actually going into pagan sources, doing human sacrifice. So that is why it's different. We are saying all this for Islamic medicine because of that belief that God did not create any disease without creating a cure. So they went into all. They went into searching. So it's almost like very closer to us, to what we do in scientific medicine. Okay? Okay. Yes. Hello, Onyinye. Onyinye Martins. Hello, Onyinye.
Okay, good evening, Prof.
Good
evening,
ma.
everyone. Thank you for. Sir, can you hear me? Please confirm
Yes, I
you can
can.
hear
I
me.
can. Yes.
All right, sir. Please confirm you can. All right. Okay, so my question or confusion is about this particular man that was a Jewish rabbi.
Yes. Moses
Moses
Maimonides.
Yeah. So my question or my thoughts, my little thought. I know that the little history I know about the Torah was used as a guide for Judaism or for the Jews before the introduction of Christianity. So they used it to live their life, what they do. Those are laid down rules that they gave themselves, even up to healing or treatment of some form of diseases, even lifestyle. It was just basically like a school, like the way they teach other people, teach the Quran from a certain level. All the boys, most times, or mostly the men, were allowed to read the Torah, and then some people graduated and became rabbis. So the point I'm trying to make is, don't you think Moses Maimonides also had a little bit of contribution from, will I say religion now, to his treatment methods,
No.
as
So
he also
that's what we
combines it with
said now.
medicine?
That's what we said, that he
Okay.
combined the two instead of separating the two. He combined
Okay,
them. So he
okay.
used the
Okay,
knowledge of
sir.
one to improve the practice of the other. That's what we
Yes, sir,
said.
because there's something you said about us being two-faced, about
No.
our
I said two-faced. Two-faced in the
Yes.
sense that, as a
Okay.
doctor, there are certain things that you hear during testimony that you know that are being cooked, made up. And we still praise the Lord to thank God for them. So which means we have left that medical understanding into believing miraculous things. Anyway, they are called miracles because they are not they are not normal. They don't happen in a normal way. So that is the thing. That's why I said this. We are two faces. But this guy, he used the knowledge. Well, I must say that I used to say that the power is in the word. The power is in the word. When they did a study amongst Christian denominations in the US, the people with the highest life expectancies were those of Seventh-day Adventists and the Mormonites. The Mormonites are not even are derided by mainstream Christians because they have books that are not of the Bible. But they abstain from alcohol. They abstain from certain foods. They don't smoke. They don't drink alcohol. Just like the 7 days, and they have Seventh-day Adventists, and they have the highest life expectancies. And these are good lifestyles. And most especially, they believe in modern medicine. So the power of the word is not magical. It is in their practice. If you abstain from alcohol, you will not have those diseases that are alcohol related, and you will not get drunk and die from accidents, and you will not kill people through drunk driving. And if you abstain from certain foods, like pig with its high content of saturated fats, you may not have your cholesterol level will be normal, and you will not have those metabolic problems. You see, so that's what is there. Is there? Is not So you use the knowledge of one to improve the practice of the other, and not to keep your medical knowledge somewhere. And funniest thing is that some of them will be a professor, probably a professor of medicine, will be there copying when the pastor is moving wrong stuff. Copying. You see the copy notes, and the pastor will look at him, and he will not write on this thing. So that's why I said. Okay, Wally Cyril. Hello, Wally.
Thank you very much, Prof. For the history so far. In fact, it's very amazing to get some of this information. In fact, sir, what you just said with respect to the churches and that, of course, I'm also a Christian. I was in a church once. A pastor was saying that he delivered a woman who had been pregnant for 12 years and was tied not to have delivered, so that he delivered. Finally, that the woman, he prayed for the woman, then the woman delivered. After that testimony, I went to meet him after the church. That's that. What you said, well, of course, I'm a Christian, but looking at it in the other also way, that there has to be issues, so we have to balance it in the church. When women have this kind of issues, we should have a medical section who actually look at some of these things before we begin to share this wrong information. In fact, for saying that, I was almost suspended from the church. I was almost suspended.
They will suspend you.
Yeah. Yeah, that I was in misleading the society and all that. So I just took it by that. But yeah, I think it's also important that we speak up in some of these things when we are in church and when we see some things are going wrong. So that because the belief system, like what you said, the words are very mighty. Once our hearts are open, we begin to conceive some of these things. We don't ask questions. Like when you cited that God said it and I believe it. When we conceive some things that we are supposed to ask questions that we don't ask questions, it becomes a problem. So that I'm also a little bit of this thing with respect to I believe that all these lectures we are talking about, that they are what led to modern days medicine. I just want to believe that all the practice from the Islamic region and from the Christian region. I also know that maybe why the Christian faith we are not documented much was because of when the worship became Christian after Christ departed and all that. I believe that there may be also some documentation that are not actually totally incorporated. But as a Christian, I also know that there are levels of one belief that because of the Christ's existence, that it's as if the entire problem, when you have someone solving problem, why do we need to go further to look for all that? If one has a cancer and you come to Christ, he heals. What will encourage one to go and make researches? I also believe that maybe that was one of the things that make the research for the Christian faith not more elaborate. Then
Okay,
finally,
thank you. It seems you okay. Okay, it's all right. Make
finally,
it
I just wanted to say, with respect to Africa, we have seen all this and the African, and in Africa, we always believe in this secrecy and keeping to what we have. I don't know how we are going to do that, how we are going to improve on that, because even on the present day, there are also, like when you were talking about the lectures yesterday, some researches that are being done by the traditional medical system, where the orthodox system don't believe, and some persons are giving some of this testimony. So how do we balance some of these issues in Africa? How do we balance them? Thank you very much, sir.
Anyway,
Sorry,
Cyril, you gave a mini lecture, so I'm sure that you have explained everything. Anyway, for the balance, I think it has to do with the mindset. The Europeans weren't making progress. In fact, they were retrogressing. They were retrogressing from the Roman era, where sanitation was very important, to an area, a time when they said that God is not interested in the outward appearance, and it was Europe was so dirty that rats were everywhere, and they had plague, and then plague killed over a quarter of the population within a short time. So a lot of retrogression. But development of medicine or medical care is not a straight line. It's like a wave. They go back and front until progress is made. Okay. Hello, Polycarp. Polycarp, I think we have to be faster so that we can get to a place to anchor for this week. Yes. Hello, Polycarp. Okay, Polycarp. Hello, Kathy. Kathy. Okay, Kathy not responding. Okay, so Collins.
All right, Prof. Good evening, sir.
Good evening, sir. Good evening, sir.
Good evening, Prof.
Yes, Collins, just hold on for Kathy. Hello, Kathy.
All right.
Okay, Prof, mine is a brief question, though. Because when you said we are two-faced as Christian and a medical practitioner, so I want to know how we can come in as public health advocates, because to me, I felt it has to do with the policy of the entire country from the Ministry of Health, because when we don't have a saying that you cannot actually pry into somebody's organization like churches to speak with people, that you have these people coming to people with terminal illnesses, and at the end of the day, they decide not to take their medications and they are healed, and most of them end up dying because the situation will get deteriorated. And you will not be able to sue who is giving them this information. So what can we do in health sector so that this awareness can be out there?
You know that they are powerful men of God. They are powerful. In fact, of course, politicians, when they are soliciting for votes, they go to them for endorsements because they know that their words are followed to the latter by their followers. You know, they are almost like treated like the demigods, the way they worship them, the way they respect them, you know. So the tendency is for people not to get them angry. Okay, that is our practice. But abroad, I think they are very they are proactive. Pastor Chris has been banned severally and fined severally in the UK for some of his statements. Have been banned. No, because you know what I don't like is that you know, that's why I'm saying that this knowledge of the health sciences, you cannot get it by inspiration. And that's why you will still refer to that maladies. You know, for the Jews, that guy was seen as higher than the lesser prophets in the Bible, all those Malachi and all those people. Maimonides was considered much higher than them.
I'm not going to say you. I'm not going to say you.
They were higher than all of them. So, but he didn't claim to have gotten inspiration from God. He learned. So somebody with no knowledge of medicine, and I'm even talking about cutting edge medicine, will be talking with authority. No. Okay, it's all right. Hello, Collins. Because we need to get to a point.
Okay, sir. Good evening, sir. Thank you for the lectures. So my own is just very quick one. My question is about before the contemporary era, the medieval era, about Egyptians and Mesopotamians, their contribution to knowledge. Do they have any contribution in medicine during the era? Because I know the writing of the hieroglyphs in the Egyptian era. Do they have any linkage with the Grigo? Because I didn't hear you mention about them, and I know they have a very strong history.
No.
With the academics, the Mesopotamians and the Egyptians, and the writing with the hieroglyphs. Thank you.
Anyway, we are trying to keep it as brief, as precise as possible. They also had that, and of course they had connection. You know that Moses was trained in the Egyptian court, and in Egypt, yes, in Egypt they have both papyri for medicine and surgery.
Yes. Even embalmment.
Yes, and the Mesopotamia. In Mesopotamia, they have this astrology. They are good in astrology and even to interpret dreams. And you remember that Abraham was of the of Chaldeans.
Yes.
So he came from Mesopotamia, and they were known for their ability to interpret dreams. And that served Joseph well when he was captured and went to Egypt, because he was able to interpret the dreams.
Yes.
Yeah? And astrology, where they use astrology in a diagnosis, and a lot of other things. Okay, thank you very much. We had to keep it brief, so that we'll be able to cover because this course is actually 3. We'll talk about history, we'll talk about ethics, and we'll talk about legislation, public health laws. So we don't have a lot of time to move. So we go to we go to history of medical services in Nigeria. So this history of medical services in Nigeria, modern medicine was brought into Nigeria by the British. And when the British came, they came with by force. The West African Frontier Force to fight and to conquer. So, and you can't have an army without a medical corps. So, unfortunately, malaria killed more British than our ancestors did. Malaria killed more of them. So for the medical corps, they had to provide a lot of incentives. They doubled their salary. They gave them 1 year leave. They work for 1 year and go for leave 1 year. And even 1 year of service was counted as double upon retirement. Okay, so instead of 35 years, the usual 35 years, it means that it meant that they worked for 17.5 years. And even that 17.5 years, they had to work half. So it was a generous incentive. Unfortunately, a lot of them didn't last up to 1 week before they died as a result of malaria. So that forced them into employing the natives. So they started with the first medical doctors, Western trained medical doctors. And the first were Africanus Houghton Bale and William Davis, who graduated in 1859. So they are recognized as the first Nigerian medical doctors. But I must say that they are Nigerian only by ancestry, because they were Nigerians only by ancestry because they were born in Sierra Leone, whereas, of course, freed slaves, and they didn't even practice in Nigeria. Africanus Houghton Bale was of Igbo ancestry, while William Davis was of Yoruba ancestry. Okay, so when the British, when they came, they established military hospitals. These military hospitals took care of the soldiers. They took care of the soldiers, and they are mainly established at the garrison towns where they had those soldiers. But immediately they conquered and declared sovereignty over Nigeria. It became their responsibility to provide medical care. It became their responsibility to provide medical care. So the first thing they did was to convert their military hospital to a general hospital. So they convert their military hospital to a general hospital. General hospital meaning that the hospital is open to everybody. Okay, so they converted the Lagos military hospital to Lagos Colonial Hospital. And this Lagos military hospital was built in 1873. This Lagos military hospital was built in 1873. So we can say that the first hospital, the first general hospital, or the first hospital that was open to the general public, was this Lagos military hospital that became Lagos Colonial Hospital. Okay. So that you have to note that. But the first purpose-built general hospital was the St. Margaret's Hospital, Calabar, that was built in 1891 as a joint venture between the colonial government and the Presbyterian Church. So the St. Margaret's Hospital, Calabar, started de novo, ab initio, as a general hospital, while the Lagos Colonial Hospital was transformed from a military hospital to a general hospital. Okay, so and when these hospitals were built, the colonial government noticed, or the British colonialists noticed, that the hospitals were a big draw. People liked it because these hospitals were able to treat those diseases that were considered incurable. One of which would have been hydrocele. Hydrocele was probably one of the worst diseases to get in the pre-colonial period because they were incurable. The traditional medicine practitioners couldn't cure them, and those that had developed hydrocele were ridiculed in life and thrown into the evil forest in death. So, but at these hospitals that were being established by the colonial government, hydrocele was treated, and people could even go home within a week of the surgery because it was a simple surgery. So it was a big draw. It was a big draw. People traveled from far and wide to get treatment in these hospitals. And when antibacterial agents were introduced in 1935, it was miraculous. It was miraculous because that a single shot of injection was able to wither yours. Yours was the scourge of children of the colonial, pre-colonial and the colonial period. Yours was sore all over the body like that, like those of Job. And mothers, our mothers, our ancestral mothers, they found it very, very difficult to treat. They tried everything, nothing worked. Until they tried everything, nothing worked. But this just one shot of injection was able to wither the yours, and people got cured almost immediately. Okay, so because of that, the colonial government, they established hospitals all over, just as immediately towns, they were quickly established in the newly subdued or established towns. Okay, then they also have these colonialists. They also had special hospitals meant for the European population, built in the GRAs. For example, in Port Harcourt, they built the Port Harcourt Nursing Home, now the River State University Teaching Hospital, in 1905 to provide medical services to the Europeans. Okay, they also established infectious disease hospitals because epidemics were very, very common. So they established infectious disease hospitals to forcefully treat those to isolate and forcefully treat those with these infectious diseases. Okay, so these infectious diseases were more like the prisons for those with infectious, those infectious epidemic diseases. And these infectious diseases were built all over the country in the major towns of that era. But a lot of them have been converted to other use. So the prominent one, the one that is still being used for its original purpose, is the Yaba Infectious Disease Hospital, Yaba, that is still being used, including during the last COVID-19 pandemic. Okay, so the colonial government, they also recruited colonial medical officers. These colonial medical officers were the doctors in the district hospitals that were established in those areas, in that period. And they also took care of those in the prisons, and they also supervised services in the rural dispensaries. So they moved from the district headquarters to visit the rural areas where they had dispensaries. Although they traveled in comfort because they were ported, they were carried from throughout the journey, and it was said to be like a relay race. Each community would have to carry the medical officer or the district officer throughout his territory, and then hand over to the next community at the boundary of between those communities. So that was how they traveled. That was how they traveled. So these medical officers then went to these rural dispensaries, and these rural dispensaries, they were basically treating these tropical ulcers. Tropical ulcers were all over, were very, very common during this period. Tropical ulcers. And these ulcers were not even caused by injuries. They were not caused by injuries, but they were caused by microorganisms. They were caused by microorganisms. And those, they kept the staff of the rural dispensaries busy, because There were so many of them, and the wounds were disgusting and disfiguring, as you can see in this picture. Okay, the colonial government, they also established the mobile feed units. Mobile feed units, they moved from community to community. They moved from community to community, showing health education film and then immunizing people, showing health education films and then immunizing the villagers. Then this rural midwifery program, this was established not by the colonial government, but by the church, especially the Church Missionary Society of the Anglican Communion, because the medical services that were provided were actually provided by male staff, by male workers. So people were not comfortable letting this male staff take the delivery of their wives. So that was the reason why the Church Missionary Society established the rural midwifery program that trained local women on how to take delivery and then establish maternity homes in those communities. So they took delivery there, and they also did some community health education, not only to encourage the patronage of the facilities, but also to discourage the harmful traditional practices like the killing of twins. Okay, let's just quickly talk about the prominent personalities of Nigerian medical service. We have talked about this guy, Africanus Horton Bale, and William Davis, who are the first Nigerian doctors who are regarded as the first Western-trained Nigerian doctors that graduated in 1859, even though they were technically Sierra Leoneans. Okay, however, the first Nigerian doctor to practice in Nigeria was Nathaniel King. Nathaniel King was a private practitioner. He provided medical services, especially to the missionaries of the Church Missionary Society. And once in a while, he will serve as a local doctor in the Colonial Hospital, Lagos. I assume that he wasn't interested in the natives because they didn't have much. They didn't have much money. He wasn't interested in being paid with chicken and goat and yam and cassava. So that's why that was the reason why he concentrated in providing services to the missionaries. Okay, so but the first doctors that were employed into the civil service were Obadiah Johnson and John Randall. And they were employed following what they call the Adeolu scandal. Adeolu was a destitute who was sick and was brought to the Colonial Hospital, Lagos. She was treated, but she died. So the scandal was that they felt that she wasn't given adequate treatment. That was why she died. And that she wasn't given adequate treatment because there weren't any indigenous doctors. So this created an uproar. And in response, the colonial government employed Obadiah Johnson and John Randall. So, but the thing there is, if this could cause a crisis in 1888, not that a destitute wasn't treated, but that she wasn't given the adequate treatment. Not that they asked for payment before treating her. They treated her without asking for payment, but they felt that she wasn't given the appropriate treatment because she was because there were no indigenous doctors. And I want to ask, do you think that this is possible in Nigeria, in present-day Nigeria?
No, sir. No, Prof. Okay.
Yes, which means that we have not made progress. We haven't made progress. Okay. So the other person I want to talk about, I think we mentioned him when we started this course, Okuntala Sapara. I want to mention him because he was one of the earliest Nigerian doctors. I would not want to mention what he did with the smallpox worshippers, but the fact that he combined traditional medicine with orthodox medicine, and he even created his own formulation, including Bomoro. Bomoro, I know that, I don't know, I think the last time I saw Bomoro was probably 10, 20 years ago, but it was used. So he created his own formulation, because before he went to medical school, he was a chemist. He sold patent medicine. I don't know if it's patent medicine or, because then they were mixing what looks like chemicals to give to people. But he sold those drugs in Accra before he went to medical school. So when he came back, he tried to combine traditional medicine with orthodox medicine. We want to also talk briefly about the church, what they did. The church played an active role in provision of medical care in Nigeria. They played an active role because they used medical care as a tool of evangelism. They use medical care or medical services as a tool of evangelism, perhaps showing that, telling our ancestors that their God, as shown in the medicine, in the orthodox medicine, is far, far better than the gods of our forefathers, as exemplified by the medicine provided by the traditional medicine practitioners. So we have Christian missions. The Christian medical missions that played the most prominent part include the Roman Catholic mission of the Catholic Church, the Church Missionary Society of the Church of England, the Church of Scotland, Methodist Medical Missionary Society, the Baptist Mission, the Sudan Interior Mission, and the Sudan United Mission. They all played prominent parts. The Roman Catholic Church perhaps played the most prominent, because at the time of Nigerian independence, more than 40% of the inpatient beds were provided by hospitals run by the Roman Catholic Church, Roman Catholic Mission. So, and they are still very, very prominent especially in Southeast Nigeria. They are still prominently providing medical services. Then we have the Church Missionary Society. I like their templates because they gave medical training to their missionaries and provided them with quinine. And quinine at that period was by far the most effective drug. So I'm sure that they performed some miracles with the quinine, because I could see in my mind's eye that they would have walked into the hut of a woman with a child, feel suffering, blaring with high fever, gasping for breath. And I could see, if you wonder, if you know, or if you believe that they can give the quinine to that child, and that child would have recovered or felt significantly better by the next day, would have been seen as complete magic, or magic. So, but this the missionaries of the church missionary societies were encouraged to build a church and also attach a dispensary, so that they are able to provide not only to the body, minister to the spirit through the church, but also to the body through the dispensaries. And they built dispensaries, and they built a lot of dispensaries, especially also in the Niger area, in the diocese of the Niger, led by Ajayi Crowder. Then the Church of Scotland, the Presbyterian Church, they were also very active in Upper Cross and the Ebonyi State. And of course, they built the St. Margaret's Hospital, Calabar. And of course, they have this Mary Celeste that stopped the killing of twins. Then the Methodist Church, they also had theirs, had hospitals, including big hospitals like Wesley Gill Hospital, Elisha. And they also have they are the ones that established the big leprosy settlement at Uzakoli. The Methodist Church, they also provided hospitals, they built hospitals, and the most, it is interesting that the Baptist Mission were the first to introduce dental services in Nigeria. They are the first to introduce dental services in Nigeria. The Sudan Interior and Sudan United Missions were established, they practiced in the North Central, and their intentions were to stop the Muslim conquest of those traditional, of those indigenous, of those previously pagan population. Okay. They were called Sudan, not because they were based in Sudan, but because Sudan was the name given to the part of Africa, given to the part of Africa south of Egypt, south of Egypt. So that was why they were called Sudan. And they built their own hospitals. They built hospitals like the Evangel Hospital, Jos, where Lassa fever was isolated. And then, yes, and then they also introduced some crops. And I must say that apart from the medical services, these missionary societies, they are the ones that introduced some crops like cassava. Cassava is not indigenous to Nigeria, but they were brought in by the missionaries, and then the other persons, by the missionaries and cassava alone solve the hunger problems in Nigeria. Solve the hunger problems in Nigeria because the yield of cassava is significantly higher than that of yam that is indigenous. So these missionary societies, they also did that. Okay, so quickly I will just add the history, because the Muslim societies, they also, in the Muslim communities, the Muslim North, they also had medical services, but they weren't allowed. The Christian medical missions were not allowed to spread to the North. They were prevented from spread to going into the North, except with the permission, except they get the permission of the emirs, and the emirs didn't give their permission. So most of the medical services were not provided. Were provided by the emirate councils, and the emirate councils managed to establish hospitals. They managed to establish hospitals in urban centers, whereas the rural areas were left to continue with Islamic medicine. The rural areas were made to continue with Islamic medicine. But we must say that the hospitals they built in the urban centers were said to be of very good quality. So I assume that they employed doctors. And nurses to provide services in those hospitals, to provide those services. But the Christian medical missions were later allowed, but they were allowed to provide only treatment for leprosy patients. So they were only allowed to provide to set up leprosy settlements, and not the usual medical practice. Okay. Okay, so I've gone through. I don't know if there are questions or comments, because this is where we are going to anchor today. So tomorrow, next week, we'll continue with the history of public health and then move forward. Okay. Hello, Kenneth.
Yeah, Prof, thank you so much once again for this wonderful information, detail. You know, I realize the challenge we have in Nigerian medical services is belief. Belief is one. And until that belief is handled properly, we have a biased belief in medical field in Nigeria. So second question I want to ask now is, you mentioned that cassava was introduced into Nigeria, rather. So already they were depending on yam, and I know cassava has caused so many health challenges. So, Prof, my question is, cassava originates from which country? Which brought cassava to Nigeria? So I will know how to handle them.
No. Cassava, cassava is indigenous. They from the Americas. Yes, indigenous. I don't know if it's South or Central America, but it's not indigenous to Nigeria. And you said Nigeria, cassava, of course, don't say it to those members of the people of my community, because they just, when they want to thank God, they thank God, the creator of cassava.
Yes, sir.
You say when they want to praise God, they say they thank the God that created cassava.
Okay.
Yes, yeah, because you don't need much. You don't need much effort to plant cassava, but you need to go to farm almost every day to attend to your yams.
Yes, Prof. Thank you, sir.
And the yield per hectare is significantly higher. Yes. Hello, Rosemary.
Yes.
Hello,
Good
Rosemary.
evening, Prof. Yes, sir. Good evening, Prof. Thank you for the lecture so far.
Yeah, good
Please,
evening.
sir, I want to go back to the slide. The slide of the different hospitals brought into the country. The slide, there is a kind of mix-up there.
Okay. Which one?
The invention of hospitals, the one that has Enugu, Port Harcourt.
So why is there mix up there?
From the side, they wrote Enugu 1905, then Port Harcourt 1916. But in the right up in the center, they wrote Port Harcourt 1905.
No. What was built in 1905 was the Port Harcourt Nursing Home. This was a hospital for the Europeans. So they built hospital first for the Europeans before building a general hospital in 1916. Yes, okay. So don't confuse them. Yes, don't confuse them.
Okay, sir.
I don't know if you are in Port Harcourt, if you are used to Port Harcourt, you know that there used to be a general hospital that was the University of Port Harcourt, temporary site of the University of Port Harcourt Teaching Hospital. Was demolished by Amechi. And you have right in here, now you still have Bestway Memorial Hospital. Hello, Agama Success.
Okay, good evening,
Hello.
sir. Hello,
good evening.
Sir. Good evening,
yeah,
sir.
I can hear you.
I wanted to make ask clarification on this. You said the first to introduce gender service in Nigeria. Like, I want to get that.
Dental services. The first to introduce dental services.
Okay.
We said the Nigerian Baptist Mission. Yes.
Okay, Nigerian Baptist Mission. Okay, that's what I wanted to get.
Yeah.
Thank you.
Hello, Olachi Uzoma.
Yes, sir. Thank you. Good evening, sir.
Hello.
Can you hear me, sir?
Good evening.
Yes.
Yeah, I can hear
I just
you.
want to know the reason why the Christian medical mission were not allowed to get to the north. Did they have any concise reason like why they were not allowed to get to the north?
Anyway, you know, to tell you the truth, you know, when the British came,
okay,
you know, they felt that those Christian missionaries were serving as a proko.
okay,
They were reporting them to their home country that they were doing a lot of things, a lot of bad things.
okay,
So they looked for an excuse not to. And they also had it easier in northern Nigeria because they were doing the indirect rule. In northern Nigeria, they already had an organized rulership system where you have the emir, you have the district head, you have the village head. So what the colonial government needed to do was just to provide the security and then tax, and then those rulers will do the taxing. So it was easy for them. And they don't want that to be disrupted because, of course, these other people they are coming to introduce Christianity. They are coming to introduce Christianity, so it could have disrupted the whole thing. Could have disrupted the whole thing. Yes.
Thank you, sir.
Yes. Hello, Osai. Hello, Osai. Osai Ndoka Richard.
Yes, good evening, Prof. Thank you so much for the lectures, Prof. What I wanted to add is the last person that asked a question about cassava. Yes, at least I know about that one a little, that cassava is indigenous to Southern America, particularly from Brazil and Paraguay. Okay. They are the ones that really have cassava. It's all these Christian Portuguese that came to Nigeria in the 16th century and 17th century. They are the ones that brought cassava to Nigeria. Then secondly, Prof, too, I don't know, the last speaker, the last person that asked a question concerning why did the Christianity, where were they? They didn't allow them to go to the northern part of the country. Prof, I'm thinking, is it not because of Muslim religion? Christian and Muslim, which of them came first to Nigeria?
No, you know, I don't know which one, but I of course in the north there were of course Muslims, because they came, you know, they are closer to the Middle East, so they came and jihadis, they came and then they did what they did. Yes, but I think it's exactly what was said. They didn't want that disruption because it was far easier. In fact, when they tried the indirect rule, you know, for example, you were trying to rule in Igbo land where they don't have any leader. Igbos, they don't have kings. They don't have kings. So they had to even appoint the people they call warrant chiefs. Warrant chiefs are the people because they wanted to replicate what they had in the north. What they have in the north. And I'll tell you the truth, by the time of that colonialism, I think the Europeans were beginning to enter into what they call the post-Christian age. Okay. Because right now the Europeans are fully in the post-Christian age. Because Christianity has gone down. The population of Christians in Europe has gone down a lot. And it started around that period. It started around that period when they came to realize a lot of things. And then Yeah. Yeah.
So,
But the
but
most
Prof, too,
important thing, they
then,
were
please, I want
interested
to.
in money.
Yeah, that's correct. Prof, then please, I want to beg the PowerPoints, if it can be shared for us to go through.
No, I
after
thought
the
we
lecture.
have. I thought we have that. We have that already
Okay.
shared. Yes.
All
Okay.
right. Thank you
Okay.
so
So
much.
thank you very much. Yes. Thank you very much. I'm going to anchor here this week. Next week we will start. We'll continue. Let's see how far we will go next week. Yes. Let's see how far we will go next week. Let me continue to thank all of you for your
Thank you, Prof.
participation. I know that Amarachi wants to give a vote of thanks, but we can.
No, sir. Sir, sir, please, can we get the recorded audio for yesterday's lectures and today?
I'm sure that I will probably check the LMS. Yes, if it's not there, then you report back. Okay.
Prof, please, when is the next lecture, please?
Next lecture will be Wednesday next week.
Wednesday and Thursday.
And Thursday.
Hello, Prof.
Thank you very much.
Hello, Prof.
Thank you, Prof.
Yes,
Thank
so
you,
this
Prof.
Mbata, you want to ask about registration again?
Hello, Prof.
Thank you,
Good
Prof.
evening, Prof.
Thank you very much, Prof.
Yes,
Prof,
Esther, just go on.
Some of us don't have access to the elements.
No,
They log in the details and not the truth.
Yes, I'm sure that we're also struggling to get them to grant access.
Prof, thank you so much.
They said they want to. A little payment will be made in addition to the commitment. So even if it is 5,000, 10,000, they say they will grant that. Okay.
No,
Prof, please, what of bridging the course? Is it still holding Saturday?
Yes, we will have it on Saturday. Yes, Esther, go on.
The account you said we pay the 12,000 for all that did online uploaded our credentials online. You were saying the other day that we will need to pay 12,000 that will be used to print it and be submitted in school. That we need to pay 12K. That we shouldn't pay it in the UBA account. So the account to pay the 12K is what I'm asking about now.
I don't know now because that is not part of my responsibility. But they said if you click there, it will come out.
No, it's not there. I've uploaded all my.
Madam, I don't know. Madam, I don't know. I
Please
don't
go and
know.
check the platform, ma'am. Check the platform. You will
Madam, I
see
don't
the
know. I don't know. I don't know. Please.
Payment registration and processing is directly through the portal. There is a point on the portal.
Please let us get one thing clear. This is lecture time. This is not time for so many